emojis and color them. And then if you need a do not disturb sign, those are out there already colored, or you can color your own so those pesky coworkers won't bother you. And if you need something to do during the conference while you listen, you can color one of these We Love Public Health pages. And there's also a downloadable Public Health Conference of Iowa action plan. What do you want out of the conference? What sessions do you want to attend? And then take notes. A link will be put into the chat box now so you can access all those printables. Thanks for being here today. There's a few more housekeeping items, and then we'll bring our speakers to you. If you missed yesterday and this is your first session with us, thanks for joining us, and we're glad you logged in and found the meeting link. This process will be the same for the rest of the week. Each session has a separate Zoom link found on the session listing on the Map Dynamics Schedule tab. Please keep in mind that a couple Zoom rooms have a max capacity of 100 attendees. So if you happen to enter a full room or try to, please try a different session during the concurrent session at the same time. I mentioned this yesterday, but I'll share it again for any new attendees joining us. We have a few different discussion boards open on Map Dynamics that we invite you to participate in throughout the week. Shout out discussion board, say thank you through the shout out discussion board, highlight a colleague, peer, professional, organization, business, profession, etc. for a task or job or continued service that was well done in 2020 or 2021. We hope to compile all of the responses and share on a slideshow before the start of our closing keynote on Friday. Another discussion board, support the local arts. We'd love to support your local museums and organizations that have struggled over the past year. Feel free to post your favorites along with their donation links. Let's show our appreciation to these organizations. Treasured links and resource discussion board. We have a few extra things listed here as resources to enjoy during the conference week. Have time for another midday walk? Check out a podcast we've listed here. Want another option for morning wellness? We've added a few other links you may enjoy. CEU reminder, all the CEU details can be found on the homepage on Map Dynamics. We will link it in the chat box too. The sign-in link will be listed in the chat box for each session. Please also complete the session evaluation for the sessions in which you are seeking credit. If you have additional questions about using Map Dynamics, check out the attendee FAQ document. We'll link it in the chat box now, and it can be found linked on the home Map Dynamics page as well. Visit all of our exhibitors in the virtual exhibit hall. We have an exhibit hall scavenger hunt game set up. Several of the exhibitors have a secret word listed within their booth. Find their word and enter it on the Google form. A winner will be selected from those who participate and complete the form, and they will be announced on Friday before the general session keynote. The Google form link will be in the chat box. I will now turn it over to our presenting sponsor, Brain Health Now, and Nancy Van Milligan.
Thank you, Robin and Rachel. My name is Nancy Van Milligan, and I am the president and CEO of the Community Foundation of Greater Dubuque. I am thrilled to be representing the conference sponsor, Brain Health Now. I'm proud to announce that the Iowa MHDS regions recently partnered with this grassroots organization to help end stigma surrounding mental illness throughout the state of Iowa. Brain Health Now started in Dubuque, Iowa 4 years ago. Their sole purpose is to end stigma surrounding mental illness by reframing the way we use words. Words are powerful and words matter. So when you say the words mentally ill, crazy, psycho, nuts, etc., the stigma follows. We believe that reframing the conversation towards brain health and eliminating the word mental illness creates a normalcy for the 1 out of 5 people in Iowa who have brain health issues. Brain health issues are not character flaws or a choice. Brain Health Now, plus many other stakeholders, believe that it should be treated just like any other organ in your body that might get compromised, such as cancer, diabetes, kidney failure, etc. The brain is an organ and it can get sick too. Reframing the words from mental illness to brain health gives hope that the issue can be treated, and it also shines a light on those who are dealing with brain health issues. We invite all of you to join us in helping to end the stigma in your community and throughout the state of Iowa. You can visit our web pages at www.brainhealth-now.org, or you can go to Iowa/MHDSregions.org. Thank you, and I hope you enjoy your time at the 2021 Iowa Public Health Conference. Thanks, Rachel. Thanks, Robin.
Thanks, Nancy and Brain Health Now. We really appreciate you guys and your support. I would now like to turn it over to our sponsor for today's general session. I want to turn it over to Dr. Edith Parker with the University of Iowa College of Public Health. So welcome, Dr. Parker. Are you there, Edith?
Dr. Parker, can we have you unmute, please?
Yes. You would think after months of this I would have it down, but apparently not. So sorry about that.
No problem.
Hi, I just was saying that as the Dean of the University of Iowa College of Public Health, I'm very pleased that the college is a general session sponsor for this year's Public Health Conference. We all know what a difficult year 2020 has been for those of us in public health. And I just have to say how proud I am of the way that Iowa's public health workforce has responded to this pandemic. Your commitment to the people of Iowa, your passion, your dedication have been so admirable. And I really want to thank you and recognize you for that. I think this conference, even though we're not together, and I've been so impressed with what y'all have done to build a sense of community, but it is a wonderful way for us to gather, to share experiences, discuss new ideas, hear from some incredible speakers like the two persons I'm about to introduce, and also to lift up and motivate each other. I'm particularly pleased as someone at a School of Public Health that this conference offers such a terrific opportunity for public health students throughout the state to really immerse themselves in the real and urgent public health issues of our time and learn from and other experts in the field. I think there will be several of our University of Iowa students in attendance throughout the week, and I know that they're going to have a great experience. And I'm also just really pleased to see some of our alumni on the list of presenters this week and see that they're excelling at their work and representing Iowa well. Now I'd like to switch and introduce the speakers for this morning's keynote session. First, Dr. David Dyjack is currently the Chief Executive Officer of the National Environmental Health Association. He is Principal Investigator on 3 environmental health workforce capacity building grants, 2 from the U.S. Centers for Disease Control and Prevention, and 1 from the U.S. Food and Drug Administration. He earned a doctorate in public health from the University of Michigan and the MSPH from the University of Utah, and he's a board certified industrial hygienist. Next is Dr. José Ramon Fernandez-Pena, who is a current president of APHA and is the Director of Health Professions Advising at Northwestern University. Previously, he was an associate professor and associate chair in the Department of Health Education at San Francisco State University, where his work focused on health workforce diversity and cross-cultural communication in health. He earned his medical degree from the National Autonomous University of Mexico and his master's degree in public administration from New York University. So I'd like to welcome both Dr. Dyjack and Dr. Fernandez-Pena, and I'll turn it over to Dr. Dyjack.
Thank you, Dean Parker, and I hope this is not going to be I'm not a cat moment. Let's see if we can share my screen. And let's see how we're doing here. Is everyone seeing this fine?
Looks excellent.
Thank you. I would first like to thank everyone in Iowa for the invitation to be here today. My commentary will last about 15 to 17 minutes, and it's going to be focused on the local level, on the individual level. Frankly, I think this is where public health is played out. My colleague, Jose Ramon Fernandez-Pena, will talk about things from a national perspective. And we hope between the two of us, we give you an orientation to what we're thinking about, what we're observing, and what we're seeing in public health at this time in the nation's journey. What you see in front of you is Mono Lake. Mono Lake is really interesting if you are interested where public health practice and policy intersect. It's on the eastern side of the Sierra Nevadas. And in the 1940s, the major tributaries to this lake were diverted. They were diverted to Los Angeles to provide drinking water for those that were thirsty down in that growing urban area. What happened then is that the water level dropped 45 feet. 1/2 of the volume of the lake disappeared because of the redirection of its primary source of water, the streams and rivers that flowed into Mono Lake. And what was left behind was this beautiful calcium carbonate structure, or many structures. They're called tufas, T-U-F as in Frank, A, tufas. And I got out one morning over a Thanksgiving weekend, and I drove up to the eastern Sierras to take photos of Mono Lake so that I could see it for myself. I could feel it for myself. I could understand it for myself. What happens when we make major decisions which affect the environment and the public's health? In that same spirit, a little over a week after the insurrection in Washington, D.C., I jumped in my Prius, and yes, I have to admit, I own a Prius, and I've owned a Prius for 10 years. Being an environmental person, I've always felt responsible for my part of global warming. And I drove to Washington, D.C. I live about an hour southeast of the White House. But I drove to D.C. to see the nation's capital after the insurrection of January 6. I wanted to see it for myself. I wanted to feel it for myself. I wanted to understand it for myself. And the pictures that you see in front of you, just like the picture at Mono Lake, was taken by me. This is an apolitical slide, by the way. It's neither left nor right on the political spectrum. But I needed to understand what was going on there as an American citizen. I felt compelled to do it. And as you can see on the left, this is a little display that was assembled for Officer Brian Sicknick, who died during the insurrection, and then the nation's capital just before the inauguration. It was quite a moving emotional experience. Speaking of moving emotionally, the mortality associated with COVID in our country is profound. I've given up updating this slide, by the way. I think that on March the 24th, there was something like 550,000 people who have died from COVID, much more than World War II and World War I and the Civil War and the Vietnam War. It's overwhelming to me to think about that. And yes, I believe that this could have been averted. And yes, I believe that public health was ready to provide leadership in averting that. We have the talent, we have the skills, we have the ability to have reduced this mortality dramatically. And I'll talk a little bit more about that over the next 10 minutes or so. But the pain and the questionable decisions continue on to this moment. We had Jennifer Kirtanis and Lori Freeman of NEHA speak to our board of directors about a month ago, and they talked about 20% of local health officials that have resigned. They were forced out of office, they were harassed out of office, they retired early, or for whatever reason have elected no longer to provide public health leadership. At the same time, on the right-hand side of the screen, you see yesterday's an article from the MMWR, which talks about local decision-making and then resulting in COVID cases rising dramatically in local places. Public health is profoundly local. And we need to think about that when we're talking about scaling up issues for the nation writ large. Public health is made up of all of those individual decisions that each of us as professionals and our constituencies make on a day-to-day basis. My association, the National Environmental Health Association, had an interest in individual practitioners. And over the summer, we conducted an assessment, including some of our colleagues right there in Iowa who responded to it. We had about 765 people nationwide, including the US territories, responded to a national convenience survey that had 25 quantitative and qualitative questions associated with them. And as you can see from the slide in front of you, we had representative responses from academia, the private sector, from uniformed services, from the Fed, state and local agencies, and tribal representatives as well. And what did we learn? What we learned is that everybody's scope of work, including probably everybody on the line today, your scope of work expanded. Look at the local environmental health program all the way on the left. 89% of local environmental health programs have been asked to do more during COVID. US territories are close to 100%. For those of you that work at the state level, over 80% of you, over the summer, by the way, reported having to do more. Just this week, I spoke with a director of environmental health from the East Coast who has 150 employees. Can you imagine how many he suggested to me are working on vaccination today? 143. Only 7 are currently doing environmental health. What we learned from the survey is that environmental health professionals were redirected, and probably still are, to be involved in contact tracing. And my point here is that our interpersonal skills matter. If you're an epidemiologist or a nurse or environmental health professional, a health administrator, I'm going to suggest to you this morning that who you are as a person and your character and your empathy and your listening skills are critical. Even though you may spend much of your time reviewing land use plans and inspecting restaurants, who you are as a person and how you interact matter, particularly during this time in history when there's so much emotion around public health. For folks from the College of Public Health at the University of Iowa, your training and education matters. For those of you that are supporting the training center that the college has, I want you to look at the slide in front of you. 7% of the respondents to an environmental health professional survey reported having to disperse crowds. I don't know about you. I have not 1, but 2 degrees in public health from very good institutions. And at no time have I ever been asked or taught to disperse a crowd. In fact, I was getting calls over the summer, late in the evening, people who said to me, Dave, I've just been asked to disperse a party out by a lake in a rural location. And the police have elected not to accompany me because they say it's not their job. The world is changing all around us. And those of you working in public health have probably encountered many things at the individual level that you never thought that you would have to deal with. And I had to laugh this week, actually at the end of last week, when the US Centers for Disease Control and Prevention sent me a survey and asked if I would disseminate a survey on stress to the workforce. I sent them our survey and our report. This slide in front of you shows just how exhausted people were last summer in July and August. They're frustrated, they're burned out, and they're emotionally exhausted. That's you I'm talking to. I'm not talking to somebody else. I'm talking to you. And we understand the stress that you're going through. My staff is stressed and they're not on the front lines. And we owe all of you a debt of gratitude. What I would like to do is to ask you, and just follow me, humor me for just a minute, is to get up on the balcony of your mind. You can do this once a day. You could do this once a week. You could do this once a month. And ask yourself, as you get up on the balcony and you look down on the dance floor, and this is a metaphor for life around you, for your coworkers around you, for your communities around you. What is going on? And most importantly, what is my role and responsibility in this dance? Am I a wallflower? Am I an active participant? Am I being helpful? Am I in tune with what's going on around me? And if I had more time, we could unpack what some of this looks like. But I think we're so in the moment, which is important. But when we are continually in the moment, for day after day, week after week, month after month, I think it's important to step back and reflect on what's going on and to perhaps season your decisions after reflecting on developments in your workplace, developments in your communities, and developments in public health. One of the things that I have just reiterated to myself over the last year is that science exists in a social context. When I took my 2 public health degrees, this was not very much a center of attention, and I think it should be. For those of you from the college, we need to be training individuals to recognize that science exists in a social context. There are certain principles that are very effective in the way that we communicate, the way that we get work done, the way that we get buy-in from our communities for some of our recommendations. I don't have the time to get into these, but if you invite me back next year, I would be happy to spend a whole hour just on this slide alone. There are certain principles of engagement that I think would make us much more effective. I think it's also really critical to understand that when you speak to somebody or you're communicating to somebody in person, that almost nothing, the content of what's coming out of your mouth only represents about 7% of what the person is actually hearing. So for those of you that are hyper-focused on your PowerPoints and your t-tests and your p-values and your chi-squares, you're missing the point. Your audience, your elected officials, your community members are reading your body language. They are processing your tone of voice. And until we can come across as husbands and wives and mothers and fathers and partners, I think that we're going to lose the opportunity to be much more effective than we've been to date. So now what do you do with that? I'm going to make a few recommendations. One is to dispense with your familiar grooves. I'm preparing a talk to deliver in May when I'm going to be looking into a crystal ball and talking about how environmental health will be different a year from now and 5 years from now. If you think restaurant inspections and land use plans and assessing daycare facilities and schools and the hospitality industry is what you do, it's going to change soon. So dispense with the idea that familiar grooves are something that you can rely on. I know that you're stressed, but please, we need you. I need you. My family needs you. Remain engaged. Please don't fall prey to getting into what we sometimes call BMWs, people who bitch and moan and whine. Don't do that. Please don't let that happen to you. In this new normal of COVID, maybe you need to redefine what you can accomplish. I know NEHA was hoping to have its best year ever. We were having historic highs in membership 12 months ago, and it all got derailed because of COVID. We're simply accomplishing what we can, and we had to redefine that midstream, and I encourage you to consider the same. Find new meaning in your work. Perhaps you define success or personal satisfaction before COVID in one way. You might need to recalibrate yourself and define meaning in a different way. The world around us is so dynamic. I would ask that you seek out positive relationships. And you all know what I'm talking about, right? I know you do. Those energy vampires that exist in your extended families, those energy vampires that exist at work, those energy vampires that exist in the political universe. Don't let them suck the life out of you. Those black holes where all that positive energy goes is not helpful to you. Now you can't control everybody everywhere. But if you've got these dark spirits around you, try to minimize your exposure to them. And then finally, what's between your ears is really important. Live for your ideas, not off of somebody else's. Let me show you an example of what this looks like in practice. Environmental health feels under-respected, we feel disrespected, we feel invisible, we feel like nobody understands us. And what do? We pull out our PowerPoints and say, look at all this cool stuff that we're doing, X, Y, Z. And where's it gotten us? It has not gotten us very far. I see all kinds of press interviews with people talking about, is it safe to go into the restaurant? Is it safe to go back to school? Is it safe to fly? Is it safe to go to the beach? And the people being interviewed are physicians, many who have no idea of environmental health or public health writ large. These talking heads, it's hilarious. Why doesn't someone call environmental health and ask them what their opinion is? Now, I don't know about Iowa, but at the national level, it's really frustrating for folks that have probably never had an environmental health course in their entire life are talking about recommendations for restaurants. Are you kidding me? What we're doing is trying something different. Now, let me be clear, I may fail, but at least I'm going to try something different. I have commissioned a 2.5-minute video. It's almost finished, which is a cartoon which shows environmental health professionals as guardian angels. There's going to be little science. There's going to be no technical jargon. It's going to have a soothing musical background assigned to it. And its aim is to hook elected officials. Its aim is to hook influencers. Its aim is to hook the general community so that they have a better sense of what we do as a profession and why we're important to everybody's way of life. Now, I may fail, and to my colleagues with the Iowa Environmental Health Association, as soon as it's done, I'll share it with you, and you can repurpose it if you find it's useful. But I just can't go on doing the same thing over and over again. Isn't that what somebody said was a sure sign of insanity, when you try to expect a different result and do the same thing over and over? There's a Japanese term called ikigai. Ikigai is your reason for being, your purpose in life. And for many of us, we have bachelor's degrees in public health, or a master's, or in some case, a doctorate in public health. And what I'd like you to do, if you can, is to go back to that enthusiastic, optimistic young person who decided that public health was for them, who decided that prevention was for them. That reason for electing this profession. Don't let the current state of events rob you of your joy. And if you're enjoying this year, I'm happy for you. But that's not what I'm hearing from across much of the country at the individual level. Recommit to your professional purpose in life and understand that the tone of your voice, how you dress and how you act, and the professionalism that you bring into the workplace, people are feeding off of that. You may not think so, but they are. What you do and how you present yourself, frankly, is more important than the words that come out of your mouth. I think I made that case earlier. And now for some of you, you're going to chuckle, and you can chuckle at me if you want, and you can give me grief if you want, but this is what I know. If you love what you do and you love the people around you, appropriately in the workplace, in your communities, the people that you serve, what I know is if you love that and are happy with that, you will live longer. If you love what you're doing and you genuinely love your family and those around you, you will recover from illness faster. I'm not making this up. This is empirical. This is factual. This is as factual as the attack rate of the flu every autumn. It is a fact. And by the way, the giver of love and the receiver of love both benefit. Let me repeat that. The giver of love and the receiver of love both benefit from that act. And this has been scientifically and empirically demonstrated in many peer-refereed research activities and the publications that came out of them. As I close, I want to go back to where I started, Mono Lake. And I know for a lot of us in the public health enterprise, we feel our enthusiasm's been drained away from us. We feel in some respects like we've been stretched thin, kind of like this lake that's trying to support aquatic life, trying to support avian, birds, and other forms of wildlife after much of its resource was drained away. In some cases, you might feel battered and bruised from the last year, but let me be clear. The way I perceive you, the way I observe you, the way our NEHA membership observes you, is you are like these tufas, like these structures. When the resource has been drained away, what's left is this beautiful natural architecture. and I'm speaking to each of you. I view each of you as the resource has been drained away to be a pillar of strength for your communities, to be a pillar of support for your communities. Let me be clear as I close, you matter. Each of you individually, in your communities, in your service areas, you matter. And I know that you're making a difference. I have connections all across the country, and I hear about the wonderful things that individual practitioners are doing. I believe in you. Please hang in there as we get through the next several months. On behalf of myself, my 45 colleagues at NEHA, our board of directors, and all of our members, Godspeed to you on your journey moving forward. And I look forward to meeting you again, hopefully next year in person. And we can have a follow-up on the lessons learned from the pandemic of 2020 and 2021. And with that, Jose Ramon Fernandez-Pena, I'm going to turn my screen over to you, sir.
Thank you, Dave. Thank you so much for such an inspiring conversation. And hello, everybody. I'm going to see if I can do what he did and share my screen with all of you. So give me a second here. And let's see if this is going to work. Can everybody see that? Is that a
Not
yes?
yet.
Not yet.
You might have to click one more share button for it to push out to everyone.
All right, so let me go share.
All right, it's up.
All right.
Perfect.
So there we are. Good morning. I'm really inspired by your words, Dave. Thank you. My name is José Ramon Fernandez-Pena, and I am currently the president of the American Association, and I'm very grateful for the opportunity to speak with you today. I was hoping I would have the opportunity to visit Iowa for the first time because of this conference, but you know, what happened, and here we are. Before we get started, I want to take a moment to say that I come to you from Evanston, Illinois, and I want to acknowledge and honor the people of the Council of Three Fires, the Potawatomi, Odawa, and Ojibwe, the original people of this land. Though I do not hold a Native identity myself, I acknowledge the land to express gratitude and appreciation for the first caretakers of it, and to encourage you all to learn about the long history of this land and about the land you live on. As president of APHCI, I'm going to take a moment to talk about some of the things that are happening from the mothership, as it were. As you all know, we're celebrating National Public Health Week, and in that context, I want to make sure that I extend my personal gratitude to all of you for the work that you do every day, every year, and especially this last year. As Dave mentioned, we as a workforce have been under attack, have been maligned, have been chased, have been forced to quit our jobs in ways that are or were unthinkable just a year ago. So my heartfelt gratitude to all of you who continue to do the good fight and the good work that we do in public health. In the context of National Public Health Week, this week on Thursday, we're having a Policy Action Institute that, as you probably know, brings together a number of policy experts from across the country to talk about policy opportunities and ways to work at the policy level to redress some of the matters behind health disparities. In addition to these two current events this week, you know that we have been as engaged probably as all of you with COVID matters for the past year. I wanted to highlight a couple of resources here. This COVID guidance is a series of educational materials that were developed in English and in Spanish. And if you haven't seen them, I invite you to check them out at this covidguidance.org. They're really interesting materials that have proven useful in topics ranging from basic education to vaccine hesitancy and a number of things like that. If you have not seen any of the webinars from the COVID-19 conversations, I invite you to take a look at them. They're also available through APHA's website. There have been 18 webinars thus far that we produced in partnership with the National Academy of Medicine and have brought together an amazing collection of speakers. It will be an interesting historical document to look at in the future, because we started, I think the first one was about the science of social distance. And the last one I attended was about virus variants and vaccines. So it really has covered the gamut of the experience of the past year. In addition to these resources, two more pieces I want to highlight is our series of webinars on advancing racial equity. This series builds on the 2015 series we had entitled The Impact of Racism on Health and Well-Being, which I'm sure many of you saw. And the last section I want to highlight in regards to the recent heinous acts of violence in the country. There's a conversation ongoing, and there's a body of evidence in the policies of APHA repository about policies that work to reduce gun violence. I think it's imperative that we continue to keep our finger on the pulse of this issue, and that we continue to present this matter not as a political concern, but as a public health concern. Gun violence is public health, and we need to have our fingers in that pie as well. Another important component that I want to share from APHA is that we embarked in 2019 in this project, the Member Unit Effectiveness and Engagement Project, with the idea of looking carefully at the needs and the concerns of the members of the association. We conducted a series of surveys and interviews and focus groups, and over the past almost 2 years, a very, very fat report has been released to the executive board. We're in the process of reviewing that. And we're pretty confident that this will provide the foundation for the next strategic plan of the association. As you know, we've been around for 150 years almost, and the foundation of the association then and how it has evolved over the years has been in response to the realities of our field. So we are pretty confident that we are due for another adjustment and adaptation to the current realities, and this should be the basis of our next strategic plan. So now I want to get into what I have learned and what I see over the past year, and it was really interesting to hear Dave reflect on these matters, because what I'm doing here is a little bit of that kind of reflection. And when I look back at the last year and I try to make some sense of what I've seen, I can't help but feel like I'm living in a flashback to 1985 in New York City as the AIDS epidemic was taking off. I had just arrived in the US to attend graduate school, and I found myself in the epicenter of a killer wave that took thousands of friends, colleagues, and my partner at the time. So Dave also mentioned MMWR. So this is a little flashback to 1981. In June 5th, MMWR first reported this series of PCP cases in 5 young, previously healthy gay men in Los Angeles. I find that there are striking parallels between the two major pandemics of my life, HIV and COVID, and this is why I say that. After I arrived in February of 1985, and I was confronted for the first time with this combination of fear and anger and frustration that motivated me eventually to join a group that was actually doing something to prevent the spread of HIV. GMHC, Gay Men's Health Crisis, was offering assistance and support to people living with HIV and AIDS. They had at the time the top-notch prevention programs in the country, and they had, of course, developed all these materials in English. So I began volunteering, and part of my initial job was to translate our training materials into Spanish and to develop a volunteer training program in Spanish. GMHC was very heavily engaged also in advocacy to secure funding for the service of the populations that were being most affected by the virus. It was a call to action at a time of governmental neglect and inaction. It was a vacuum of leadership that ultimately led to the death of 32 million people around the world. Today, about 40 million people are living with HIV, and while we still don't have a vaccine nor a cure, HIV disease is not being treated via combination of medications as a chronic manageable condition. Some of the most important lessons I learned through those years are the value of prevention and the critical role of advocacy. And these have guided my work since then and sustained me during this time we are living, because they remind me constantly of the importance of our work in public health. And how is this relevant today? Let's come to 2019 and this report from the WHO where we first hear about this new virus. Within a month, the WHO declared a global health emergency. By February, the first death outside China, and by the end of the month, there were deaths reported in Europe, Latin America, and in the United States. Sadly, again, the response to this new threat was in many ways similar to the response to the first reported cases of that other virus almost 40 years ago. So here we are in the present now, and what do we find? We find that, like with HIV, the urgent need to treat patients consumed all the energy and resources in the early stages of the epidemic. The medicalization of a public health emergency, also in reference to what Dave said a moment ago, we were not being funded to do the kind of work that needed to be done at this time in parallel with treating individuals who were getting infected with COVID-19. Like with HIV, there was the federal government did show no interest at all in developing a national prevention strategy, refusing to speak of the virulence of this coronavirus and refusing to model safe behaviors. This not only delayed, but unnecessarily politicized safer choices. Like with HIV, the small number of providers at all levels that come from populations most at risk creates barriers to treatment and reinforces mistrust in service agencies. The need to develop culturally relevant and linguistically appropriate prevention programs was equally hampered, as was the implementation of effective contract tracing programs. And this impact was especially severe in the context of mental health services, or as I've learned today, brain health services. Like with HIV, the dangers of living in a country where access to health services is most often contingent upon employment is once again exposed in this pandemic. And like with HIV, homophobia was the main driver in the early days of the AIDS crisis. Today, we see the impact of structural inequities and racism that feed the spread of COVID-19. So with these two parallels, at least in my lived experience, what are the learnings? For me here, the learnings are that in order to plan coordinated responses at the national and local levels, there needs to be a well-funded, fully staffed units that can effectively lead coordinated responses, from the availability of PPE and syringes to the logistics involved in the mobilization of people and equipment. The issue of the workforce and the lack of the workforce, despite efforts at many levels, the health and public health workforce continue to suffer from a tragic lack of diversity. This, in turn, remains a barrier to access to direct services and to the development of culturally relevant and linguistically effective prevention strategies. The imperative to produce and share the evidence to support policy decision-making, data collection and dissemination through non-traditional outlets needs to remain an important part of our work. Because of the nature of our jobs, oftentimes those of us in academia are urged and are incentivized to publish our findings in reputable journals, but we don't often look at the possibility of sharing these findings through non-scientific venues, through town halls, through other kinds of interventions that will bring the information directly from the researchers to the communities. The need, therefore, to partner and conduct community-based participatory research is again, we're reminded of the importance of that work again. Here I pause because I don't think I need to tell you anything about what I mean by this, but the critical role of leadership and the need to speak with one voice is unquestionable. I think that one of the biggest mistakes and the biggest errors that were committed over the past year was that inability to speak with one voice. It doesn't build trust, it doesn't build respect, it doesn't build confidence, it doesn't build anything, and instead it destroys credibility, it destroys community efforts, and it destroys the workforce. In addition to that, I think it's the bottom line is all these things may be in place, but if we don't continue to work to remove structural obstacles to health, such as poverty, discrimination and their consequences, powerlessness, lack of access to quality education, good jobs with fair pay, housing, safe environments, and of course, health services, we're not going to get very far. So as we all continue to work in our field towards achieving a higher level of equity and social justice, I just want to thank you again for the work that you do and to try to encourage you to continue to do this work. We have been through the literal ringer over the past year, and I think that we continue, as they pointed out, to be asked to do more and to do more and to do more. I hope we will all add to that list the importance of doing a little less, and the importance of taking time to breathe, and the importance of taking time to replenish and to heal. It seems that the entire world is upon us, and in some ways it is. But if we don't take that time to nourish ourselves, to find some quality relaxation and the ability to recharge our batteries, it's going to be really, really, really impossible. And last, but certainly not least, I wanted to leave you with this image. And you probably heard for almost a week, this enormous tanker blocked the Suez Canal. And I found this image on a friend's Facebook page, and I thought it was a wonderful representation of a way of thinking that ignores the root causes of disease. But you know this. I just wanted to leave a smile on your face. And with this, I'll turn it back to the facilitators. Thank you so much. And this is APHA. Thank you again, and happy National Public Health Week.
Thank you, Dr. Fernandez-Pena. It was great. Both of these were really inspiring presentations. And I guess I had asked people to go ahead and write their questions in the chat box. So if anybody does have any of those, please feel free to do that. Otherwise, if you don't have a noisy background and would want to unmute yourself, we have just about 10 minutes for questions. So maybe just to start out, I know that you had talked about just kind of taking time to grieve a little bit and replenish and nourish yourself, because we're just giving. And I guess I was curious for both of our speakers, like, what have you found solace in during the pandemic, or, you know, when things feel crazy? What have you done to feel like you're either taking action or kind of taking a step back?
Would that be a personal question or a professional question for an organization, or should I try to tackle both?
I was thinking more personal.
I personally enjoy kayaking, and I have a one-seat kayak. And when the weather warms up or when it's suitable, I put on my wetsuit, even if it's cold. And it's my way of detaching. No one will believe this, but I'm actually an introvert, and my role is often to express myself as an extrovert, but I'm misleading you. And so I need to recharge every day, and that's typically by myself. And I know it's an oxymoron, and my spouse frequently chuckles at like the way I misrepresent myself, and it's my authentic self. I just need to go and recharge. And my staff and the people that they're working with are really stressed. And so we have attempted as an organization to leverage our resources to ensure our individual staff are being taken care of. We literally provided a mental health training last summer to all NEHA staff because we saw this train wreck coming. I'm not going to say it was successful. You'll need to speak with them, but we spent the money to get qualified mental health professionals, brain health professionals. Thank you, Dr. Fernández-Peña. We got brain health professionals to lead us through trainings on how to take care of yourself.
Great. Jose, Ramon, what about you? What do you do, just personally to kind of clear your head so you can perform?
My preferred means of relaxation is cooking. For many years, I did Tai Chi, many years. And I don't usually engage in activities that make me sweat. I think that that's probably a big public health no-no, but I just don't. But Tai Chi was great because it gave me that mental silence that really silenced all the committee meetings in my head. And cooking does the same thing for me. I can just setting my ingredients in little bowls and measure the quantities. It just silences all the voices in my head. So it's very, very relaxing. Of course, then I've gained, I don't know how many pounds in this year, but it's the price you pay.
No, that sounds amazing. Thank you. Okay, somebody submitted a question. In places such as Iowa, where the state legislature has taken a very outward stance against public health, how can we ensure that rural communities are still being served? What can APHA or the different associations do to encourage young professionals to continue serving in places that actively work against them? And they want to know where you got your amazing National Public Health Week background.
It's part of the privileges of being involved with the association. I got it from APHA. That's a really important question. And I think that when I look at myself and I look at my peers, I see that, of course, we're all aging and getting towards the later days of our careers. So the importance of investing in the new generation, in the new workforce is very, very critical to me personally, and I think to all of us in public health. As new public health professionals, when students become student members of the association or of both the Iowa Public Health Association and APHA, you're immediately signed up for the student assembly as a member of the student assembly. The student assembly is the largest component of APHA. It has over 7,000 members, ranging from students doing a community health worker certificate to postdoctoral fellows at the CDC, not only in the US, but across the country. And it's an incredibly powerful network of support, ideas, thinking, new strategies, peer-to-peer advice. And I'm amazed with the work that they do throughout the association. They're very involved in the scientific program, in advocacy work, in mentoring and training. So that is something that I when students come to me for advice about thinking about careers in public health, I encourage them to join as student members for that reason.
Awesome. David, do you have anything to add there?
Maybe two quick points. One is there's a science called the science of affect heuristics. Heuristics addresses how people make decisions and why they make decisions. And I think we need to be much more in tune to that. And I think young people, if they were trained in the science of heuristics, it would be really helpful to them. Look at vaccine hesitancy, and I'm not talking about COVID, I'm talking about usual and customary vaccines. When measles shows up in a neighborhood, all of a sudden parents are motivated to vaccinate their children. That's an example of here's somebody for whatever reason was anti-vax, and then they turn that around. I would suggest, particularly, and I'm speaking to my environmental health colleagues, we spend a lot of time in the field, a lot. We aren't anchored to a desk like a lot of professions. And so we know the regulated community because we regulate them. We know school-aged facilities where children go to school or where there's daycare or where they recreate because we inspect those places. About 20% of all public health professionals, public health directors in the United States, do you know, are environmental health professionals? That's not my data, that's NACCHO's data, the National Association of County and City Health Officials. I think the actual number is 16 or 17%. I like to round up to 20. But so the interpersonal relationships are important. Don't wait for a crisis if you're a young person to develop a relationship with an elected official or with a member of the press or somebody else who may be an influencer in the private sector. We need to encourage people to develop those relationships early. So when these tsunamis of change move through, that the foundation of the relationship is in place already. And I think going back to the student section, as Jose Ramon had mentioned, I think that's really important because our role as mentors, we should take this interpersonal relationship component really seriously. And like APHA, we're doing the best we can to encourage young professionals to join. And I think my understanding, schools of medicine and schools of public health are having record-breaking years for applicants. So there's certainly a surge of interest.
Yes, and I was going to say kind of a related question. Somebody had asked, basically because public health and environmental health practitioners face incredible change and disruption, and this change is in a society that our work only continues to accelerate and get more complicated. Instead of continually asking our workforce to adapt to make change, what do you think it would take to become an adaptive workforce?
One, you need the right leader or leaders in place. And I know Dr. Fernández-Peña mentioned that, and I think he's entirely correct. Leadership matters. And, you know, adaptive leadership requires not asking people, it's leading change at a rate people can take. And that's really important, at a rate people can take. And one of the responsibilities of leadership is to push back when the demands are overwhelming. But you need experience to understand when that is. You need to know when you can accelerate and when you need to decelerate. But you know, adaptive leadership requires metering what happens so that it's sustainable over time. My concern with $2 billion in resources being flushed through the public health system, it will be just like 9/11, where we had a ton of money that moved through public health and then it evaporated 2 years later. And where did that leave us? And as Jose Ramon mentioned, you know, there's a lot we can learn from history. It doesn't repeat itself, but it rhymes. That's not my quote. I stole that from somebody else. And I think there's some merit in thinking about that.
I think there's a big role here for those of us in academia. When we look at our curriculum, and I mean, some of our programs are very focused or driven by a particular field of area. Some of our curricula in public health is more community-based education. Some are more epidemiology driven, whatever it may be. But I think it's important to stay alive, it's like a strategic plan. It needs to be a living document. So Dave mentioned that he's being asked to do crowd control, and it's like, where on earth did you need to do life control? You didn't. I mean, you went out and you put your neck out there and probably you got slapped a couple of times and then you began to figure it out. So how we manage or adapt or add or transform our learning opportunities and our learning environment, even within an established curriculum that needs to be approved by CEF and everybody else, we may be able to find opportunities for you know, rotations or community hours of service or internships that allow our students under the right leadership to develop those sort of, not necessarily soft, I think those are really hard skills that are adapted and consistent with the needs of the environment.
Great. Well, I think we have time maybe for one more quick answer to a question, and then we're going to go to a 30-minute break. But somebody had a question just about what work is happening nationally to prepare to capture lessons learned from the pandemic. Do you want to talk about that from each of your associations?
We have conducted 2 assessments and published 2 reports on the EH workforce and COVID. And although we don't have specific plans, I anticipate next autumn, when we have a chance to catch our breath, that we will conduct a 3rd one, including what we refer to inside the business as a hot wash. We'll conduct a hot wash both from a national level and an organizational level, and ask ourselves what happened. And because regretfully another pandemic will happen or something like that, and we need to be ready for that.
Yeah, APHA has joined forces with, I think it's over 72, 75 agencies right now on a program, on a collaborative we're calling the Alliance for Disease Prevention, where we are working across the country with members of philanthropy and community-based organizations and academic programs and departments of health to not only take stock of what we've done, what is happening, to really develop or try to develop a more coherent network among service providers, policymakers, funders, et cetera, but to begin that kind of post-mortem, if you wish, analysis. And I think it's perhaps good to start. I think it may be a little early to go really deep into the dissection mode, but it's an important work to do. I'm hoping to host a session during the annual meeting on exactly this topic, but I wish it to be forward looking and forward thinking instead of the, oh my God, we didn't. It's like, okay, we know that. So what's going to happen now? How are we going to be better prepared, as Dave just mentioned, for the next one? Because I'm sorry to say there will be a next one, and perhaps a next one. And it's enough already. 40 years since HIV, and we're still making the same mistakes in this country with the resources we have. That's just, I mean, it's just terrible.
Well, thank you both for being here today. We feel very lucky to have both of the top representatives from our public health organizations here with us during National Public Health Week and a pandemic. So I was going to say, I think we're just going to wrap up here. It's time for a 30-minute break. So just a reminder that you can find your next session that'll start at 10:30 by going to Map Dynamics, and you just click on the session that you want and you'll find the Zoom link in there.